Hi there, my name is Paul Whaley. I've been asked to get up nice and early on this sunny Scottish Sunday morning to record this message for Evidence-Based Healthcare Day. I'd like to tell you a little bit about the organisation I work for, the Evidence-Based Toxicology Collaboration. We are an intersectoral group that was established in 2011 to help introduce what we viewed as increasingly sophisticated approaches to handling evidence that we were seeing in the healthcare sciences to toxicology and environmental health. We work in 4 areas: on raising research standards to improve the quality of the evidence going into the research ecosystem. We work on systematic review, evidence mapping, and other evidence synthesis methods to make sure we're making best use of the best evidence in toxicology and environmental health. We work on improving the reusability of research through promoting fair data and open science practices. And we work on explainable, trustworthy decision-making, where we work on techniques and frameworks for better integrating evidence into policy and decision-making. At EBTC, we provide the infrastructure and standards for our members who work on projects that improve how we as a community create, use and publish evidence in toxicology and environmental health. We're currently supporting members working on a range of projects, including improving the use of grey literature and foreign language evidence in systematic reviews, on developing new approaches to sharing study methods to help make research more reproducible. And with the GREAT Working Group, we created the first evidence decision framework to support policymaking in occupational environmental health. The major challenge for us is that many of the issues our members are working on are in politically contested areas. People worry about what they're exposed to in the environment, the effect it has on their health. We'll have members from industry, academia, government agencies and NGOs with very different opinions about the level of health risk posed by exposure to the various environmental challenges on which they're working. The way we address this at EBTC is by focusing on process rather than outcome. For example, the specific conclusions of a given systematic review of something like the health effects of formaldehyde are not something we concern ourselves with specifically. Instead, as a collaboration and a group that manages these interactions between people who are trying to make research work better, we focus squarely on methodological rigor and building consensus around how research ought to be done, not what any given research project ought to conclude in its specifics. By focusing on process over outcome, we feel we're able to create a depoliticized space for collaborative work outside the contested spaces our members are usually working in. We think this enables us as a collaboration to make what we hope is a unique contribution to improving the functioning of the research and policy ecosystem. If you'd like to find out more about our work, please visit us at ebtox.org. And on that, I wish you a very happy and successful Evidence-Based Healthcare Day to you all.